Welcome everyone. In today's video, we are going to talk about Cauda Equina Syndrome. What is Cauda Equina? Below the ending of the spinal cord, the L2 to coccygeal nerves form a bundle which resemble a horse's tail, and this is known as Cauda Equina. Severe compression of this Cauda Equina may lead to Cauda Equina Syndrome, which is a lower motor neuron lesion affecting these nerve roots. Coming to the causes of Cauda equina syndrome, the most common cause is a large central disc herniation compressing the Cauda equina nerve roots. The most common location for this is L4, L5 and L5S1 level. The other causes of Cauda equina syndrome are spinal stenosis, trauma, tumors, infection, arteriovenous malformation, hemorrhage, ankylosing spondylitis, and iatrogenic Cauda equina following spinal anesthesia or following spinal surgery. The classic triad of Cauda equina syndrome consists of saddle anesthesia, bladder bowel dysfunction, and lower extremity weakness. Saddle anesthesia is sensory loss in the saddle area, which includes the buttock, perineal area, inner thigh, and genitals, and is supplied by S2, S5 nerve roots. Bladder or bowel dysfunction may present in the form of both incontinence or retention and is the hallmark of Cauda equina syndrome. Lower extremity weakness may present as motor weakness or radiculopathy and numbness of the lower limbs. Another important clinical feature is the presence of sexual dysfunction or impotence. It is very important to diagnose Cauda equina syndrome because it is a surgical emergency and an early surgery is crucial for neurological recovery. The classical history in Cauda equina syndrome is the sudden onset of loss of bladder or bowel sensation or control with severe back pain. The other features are saddle anesthesia or hyposthesia. History of recent impotence or sexual dysfunction should alert the clinician to the possibility of a Cauda equina syndrome. Other history features are unilateral or bilateral radiculopathy, which may present as bilateral lower limb weakness or pain, numbness, or sensory loss in the lower limbs. Examination findings are motor weakness of the lower limbs. Other examination findings may be hyposthesia or anesthesia of L3 and below. It is very important to check the anal tone in patients as the anal tone may be decreased. Bilateral ankle jerk may be absent as this is a lower motor neuron lesion. It is important to remember in Cauda equina syndromes, there are no UMN signs. The exact findings will depend on the level of the disc or pathology causing the Cauda equina syndrome. The investigation of choice for Cauda equina syndrome is a MRI scan. If MRI is contraindicated, a CT myelography may be performed. Coming to the management of Cauda equina. So, Cauda equina syndrome is a surgical emergency warranting a early spinal decompression. Controversy exists regarding the exact timing of surgery. However, a early decompression is recommended, and a decompression within 24 hours seems to have the best result. When performing a discectomy for a large central disc causing Cauda equina syndrome, the classical teaching is to do a laminectomy along with a discectomy to avoid traction on the already compromised nerve roots. An interlaminar or a minimally invasive approach may be used, but is recommended only in experienced hand so that this traction on the nerve roots can be avoided. Coming to the prognosis of Cauda equina syndrome. The timing of decompression of less than 24 hours seems to have the best results. And if the decompression is done after 48 hours, more than 60% patients have been found to have chronic bladder and bowel issues. However, surgery does not guarantee bladder bowel recovery and varying degree of recovery may be present. Thus, early diagnosis and treatment of this condition is essential for neurological recovery. Thus, the orthopedician must have a high index of suspicion in cases of low back pain to diagnose this condition early. So, friends, in this video, we discussed Cauda Equina Syndrome, which is an important surgical emergency in orthopedics. If you like these videos, please hit the like button, subscribe to the channel for further videos. Also, comment in the comment section regarding the topics you would like to be covered in the future videos. Thank you.